Welcome to my video about sciatica and the causes of sciatica, and in particular, lesser common causes of sciatica. If you believe you're experiencing sciatica at the moment and you're not seeing anyone about it yet, then hopefully through watching this video, you'll have a better appreciation of what might be causing it, and that'll put you in a better position to know what to do next in order to ultimately get rid of it. So the sciatica is a pain pattern typically involving the low back and the leg, part or all of the leg, and it can include numbness and pins and needles as well. The most common cause for sciatica is a bulging or prolapsed disc in the lumbar spine, putting pressure upon a nerve. I've covered that off in detail in a previous video, which I've provided the link for. In today's video, I'm going to talk about some of the lesser common causes of sciatica, which are no less important to know about. So let's get started with, firstly, spinal stenosis. Stenosis is a condition where the space through which the nerves travel in the spine is reduced due to wear and tear. That happens because the lumbar disc degenerates, and the disc acts as a cushioning structure, and it also acts as a spacer to create space between each adjacent vertebra. So if they are worn out and the disc height is reduced, the vertebrae are closer together, and that means the space through which the nerve travels is reduced, and it can get pinched and then cause symptoms into the leg, pain or pins and needles and numbness. That condition tends to happen evenly, so it can commonly it affects both legs, although it can affect just one. It's a condition of advanced wear and tear, so it tends to be more prevalent in an older age group. People who suffer from stenosis commonly find that a position of comfort is where they are sitting or leaning forward, because that tends to open up the space between the vertebrae and can take some pressure off the nerves. Next is osteophytes. Osteophytes are bony outgrowths around the edge of a joint, basically a bone spur. This happens in the presence of, when there is degeneration of the protective joint cartilage on the surface of each bone of the joint. So it's the body's way of compensating for that reduced cushioning ability, and it does so by increasing the surface area of the joint. Osteophytes are common in the large load-bearing joints of the lower limb, the knee and the hip, and they also occur in the joints of the spine, which are also load-bearing joints. They're a bit more problematic in this area because, of course, it's a busy area, and one of the structures that lies close to the spinal joints is the spinal nerve, and so an osteophyte can cause pinching of a nerve and subsequently sciatic pain. Because it's essentially an osteoarthritic condition, if someone is suffering sciatica and they also have the presence of an arthritic knee or arthritic hip, then there's a greater possibility that the sciatica could be linked to osteophytes. Moving away from the bony structures of the spine now, and moving on to something called Piriformis Syndrome, which is muscular. So the piriformis muscle is a muscle which lies deep in the buttocks. It runs horizontally from the tailbone out to the edge of the hip, the bony point of the hip, I should say. It intersects the sciatic nerve, which travels vertically, and if there is excessive tension in the piriformis muscle, then it can have a compressive effect upon the sciatic nerves, and that can lead to a deep ache in the leg or a tightness in the leg, and of course pins and needles and numbness whenever there's nerve tissue involved. One of the features of Piriformis syndrome, which can distinguish it from the others, is that there tends to be an absence of low back pain. Typically when I see someone with this condition, they tend to be someone who is active and taking part in a repetitive or endurance activity such as running or cycling. Next is scar tissue. Scar tissue can cause adhesions or tethering of the nerve to surrounding structures, and that can happen because of fibrosis, which is fibrous tissue is laid down around the nerve, and that's part of the healing process when the body responds to injury. A situation where scarring can cause sciatica would be if someone has undergone spinal surgery, or there's been a significant tearing of the hamstring muscle, a hamstring strain. Now, not to be left out is tumour. Just as in any part of human physiology, there is the possibility of tumour. Tumour is the proliferation of cells. So if there is tumour around the spine, then of course they can take up space and put pressure upon a nerve. This is the least common of all of the conditions that one would expect to cause sciatica, and you would really only give it consideration if there was an absence of any of the symptoms or behaviour associated with the conditions that I've described. So in summary, all of those conditions that I have described have their own management strategies, and some respond better than others. Physiotherapy has a role to play in each. If you were to go to your GP with sciatica, chances are you'll get some advice and a prescription for some painkillers, unless there were some obvious alarming symptoms which necessitated urgent referral to a spinal surgeon. Now, if you're experiencing sciatica and you've not seen anyone about it yet, then hopefully that's given you a better indication as to what might be causing your pain. The best thing you can do at this point really is to go and see a physiotherapist, get a thorough examination, a working diagnosis, and a treatment plan to ultimately get rid of the pain. So I hope you found this video useful. Please give it a like, share it out, particularly if you know someone who would benefit from it. And if there's any questions, any comments, please leave them in the comments section. And of course, if you've got any sciatica stories of your own, please do share. Thank you for watching.